Retention means that the oil is kept in the rectum for a period of time to soften the feces and lubricate the rectum. This allows the feces to be moved through and out of the body more easily. The solution in a phosphosoda enema causes irritation to the lower colon and activates the urge to defecate. The tip of a small volume enema is pre-lubricated. It comes from the manufacturer that way, so additional lubrication may not be necessary. In some facilities, you may be asked to warm the solution by placing the enema solution in a warm water bath before administration. In other facilities, you would be administering this enema just at room temperature. So check with the nurse in your facility to see which is the preferred method there. Now I'd like you to watch a demonstration of administering a small volume enema. Explain the procedure to the patient. Provide for privacy. Lower the head of the bed to the horizontal position and elevate the bed to a comfortable working height. Be sure the side rail on the opposite side of the bed is raised. Lower the side rail and cover the patient with a bath blanket. Put on your gloves. Open the package and remove the enema container. Have the bedpan and cover on the chair close to the bed. Assist the patient to turn to the left side and flex right knee if tolerated. Place the bed protector under the patient's buttocks. Expose only the patient's buttocks by drawing the bedding upward around. Remove the cover from the enema container. Gently squeeze to make sure that the tip is undamaged and to remove any air in the tube. Ask the patient to breathe deeply and bear down as you insert the lubricated enema tip 2 inches into the rectum. Gently squeeze the container, starting at the bottom, until all the solution has been administered. Remove the tip and place the cover on it. Encourage the patient to retain the enema for 20 to 30 minutes. Carry out the remaining steps as with the large volume enema demonstration. Rectal suppositories are cone-shaped, semi-solid medicated substances that frequently contain glycerin. They are approximately 1.5 inches long, and they work to stimulate the inner surface of the rectal lining, creating the urge to empty the bowel, as well as lubricating the stool for easier evacuation. Suppositories may also be used to administer medication. Sometimes when patients are throwing up and can't take any medication by mouth, they will administer an anti-nausea medication by suppository. These medicinal suppositories must always be inserted by the nurse. In some facilities, nurses will be responsible for insertion of the laxative type of suppositories as well that help promote bowel movement. In other facilities, however, you as a caregiver may be taught some special training to insert the laxative type of suppositories. Make sure that you follow the policy and procedure in your facility. Now I'd like you to watch a demonstration of insertion of a suppository. Explain the procedure to the patient. Provide for privacy. Adjust the bed to a comfortable working height and place the bath blanket over the patient. Apply your gloves. Position the patient on the left side with the right knee flexed, if tolerated. Expose the anal area. Lubricate the tip of the suppository as well as the finger to be inserted into the anus. Insert the suppository using the finger about 2 inches into the rectum. Encourage the patient to hold the suppository until he has a strong urge to defecate. Complete the steps as with the large volume enema demonstration. It's essential to be accurate in your reporting and recording of information about enema and suppository administration. Things that you want to be sure to include are the amount of the solution that was given. How well was it tolerated? Was there any cramping or pain involved? Was there any excessive flatulence? That's the term we use for gas. How about abnormal color or consistency of the stool? What was the amount of the stool? Was there any blood, pus, mucus, undigested food, or other abnormality present? If you are unsure of what to chart or how to describe something, be sure that you check with the nurse. Save anything that looks unusual. Remind the patient not to flush the toilet so that you can see the results yourself if they're going to be using the bathroom. Even if you do not give enemas in your facility, you will often be the one who will put the patient on the toilet or bedpan and care for them after the enema or suppository has been administered. The appearance and composition of feces are important indications of whether or not the digestive system is working normally. Be sure that your body expression and your facial features do not show disgust when caring for patients' elimination needs. Remember that bowel activity is a normal bodily function. This requires the same care and attention given to all patient activities.